With no end to the COVID pandemic in sight, the NHS is braced for what could be the worst winter in 50 years. A combination of coronavirus, flu and other respiratory infections is forecast to increase hospitalizations and stress the already thinly stretched health services. Coming out of lockdown life, overall immunity to influenza and other infectious pathogens has waned, which Deputy Chief Medical Officer Professor Jonathan Van Tam said is a significant public health concern. To prevent the NHS from collapsing under the strain of increased flu infections, the health service will aim to vaccinate against the flu a record 35 million people, more than half of the UK's population. The government is also rolling out COVID booster jabs, with an estimated 28 million people in England eligible for the shot. Data published by the Academy of Medical Sciences suggests between 15,000 and 60,000 people could die from the flu this year. Dr. Iram Chaudhry, Medical Director of Men's Health Platform Manual, has now told epress.co.uk the same measures that kept us safe from COVID may have made us more susceptible to other infections this year. He said, WES old, in theory, partially attribute ETZ to the lockdowns, social distancing, hand washing and measures taken to reduce mixing and exposure to pathogens. It's being dubbed an immunity debt by some specialists, which occurs when people who haven't been exposed to typical levels of viruses and bacteria suffer a spike in illnesses when they come into touch with one. The COVID-19 SARNTROL measures, MAZKWA a ring and social distancing, RARLLU work, and THUWORK really WELLFOROTHERREZRIRATORU pathogens. Hand WAZ hing, VENTILATON, and MAZKWA a ring ARENTONIU im RORTANTFOR COVID-19, they KE or other INFSTOUZME SROBSATB2. The positive is that these measures kept us safe from the coronavirus and other contagious pathogens that are present this time of the year. However, Dr. Chaudhry said this means we are potentially more vulnerable to the same threats now that many restrictions on public life have been lifted. He added, on an individual and community level, humans would develop immunity towards cold viruses. Normally, more than half of the population would have been exposed to this virus in the previous 5 or 6 months. It has now entered the community when fewer are immune to it, and it is spreading. We've actually been zing a reze and the num erof coughs and srldz and valinfstonz in general. It mo not be COVID, but at iz link edtowhatz happened in the past 18 meters onthz.